behalf of the Intergovernmental System Panel, welcome all of you to this session on the supply chain. And I'm not going to describe the topic any more than to note that it's how the supply chain is affecting our public policy in a number of different areas and how we can improve on it. And to lead us through this discussion and moderate, we have nothing other than Catherine Willoughby. And Catherine, I'm not going to give you all of your what you do and how you do it, other than in the area of emergency management, has been a real leader for the panel and in the country. And the supply chain has significant impacts on how we respond to emergencies. And rather than say any more, I'm going to introduce you and turn it over to you. And we have a terrific panel today of people who know something about this, and they can really help us understand where we take it. So Catherine, it's over to you.
Absolutely. Thank you, Mark. And this is a great panel of experts, and we're going to get a lot of solutions today to some big problems. So today we have John Bartram, we've got Steve Hamill, and we have Greg Burrell, and they're each going to speak about some pretty significant problems that were exposed because of COVID, and then talk about how we can take care of them. Each one will present, and they will explain their background a bit, and then go into detail about three specific problems related to our supply chain. So John, I think you're going to start it off.
Okay. Again, thanks folks, and I appreciate you using this paper and all the input that fellow Academy fellows gave me as they reviewed my document. But so I am a retired federal senior executive who spent more than 3 decades, 7 years working in the House of Representatives, and 5 years working in the Office of Management and Budget, and the rest of the time in different federal agencies from VA to DOD to HHS in the budget and policy arena and on some operational issues. In parallel to that, I've spent 36 years now in the Department of the Air Force as a Air Force officer, and I'm the a general officer in the reserves and the mobilization assistant to the Surgeon General of the Air Force. And last year, I spent about 7 months as the deputy for the Emergency Support Function 8 for the whole of federal government response. So I dealt with these on a day-to-day living basis with the some of the supply chain issues. And I currently run a small strategic advising company called Bright Star Innovations Group. So that's a little bit about me. But and Catherine, you want us to introduce ourselves and then talk about the items, or do you want us to all introduce ourselves first?
Introduce yourselves first, and then give your presentation.
All right. So Stephen, do you want to introduce yourself?
Yes, thank you, John. And thank you, John, for this great think and discussion piece that you put together. I think it's a wonderful foundation for this discussion today. My background, I was the assistant county administrator in Alameda County. That's where I started my government career. With the National Association of Counties, after I left government, I founded the U.S. Communities Government of Purchasing Alliance. It focused on state and local cooperative purchasing. I call U.S. Communities a 20-year overnight success. We did business with more than 60,000 independent government agencies out of the 90,000 state and local agencies in that enterprise. Today, I have founded an intergovernmental public-private partnership with Fairfax, Maricopa, Los Angeles, and Sedgwick counties to deliver a new technology-based marketplace to streamline and simplify the sharing and access to government contracts. And Catherine, I was prepared to just give just an overview of what I see as the challenges, but we can hold that off until Greg introduces himself if you want to do that. Greg, I'll turn it over to you.
Well, thanks so much. This is Greg Burrell, and I'm going to apologize for not being on camera. I'm having a couple of little challenges with that today, so I thought best to be able to call in. I am the former director of the Strategic National Stockpile. I retired in January of 2020. I held that position for a little over 13 years. My total government career spanned 38 years, starting with Internal Revenue Service, moving to the General Services Administration, and then at the senior level in Federal Emergency Management Agency, and moving on to become director of the Strategic National Stockpile. I currently operate a small business that's engaged in global health security advisory services with an emphasis on supply chain, medicines, and medical countermeasures for CBRN threats and pandemic threats. I also hold a position as Chief Strategy Officer for a small startup company called Life Protect that has entered the PPE market. Very happy to be here today.
Thank you, Greg, Steve, and John. And now John's going to talk to us about his paper and his exposure of various problems and get into a little bit about supply chain.
I think what I'll do is I'll start with a little bit about the problems that I saw, and then Steve and Greg, if you can talk about that, and then I'll do a little bit more into the paper just to kind of help keep the focus. So when I was, well, for years, as I've dealt with the national security issues and national response, there's been an issue that we've all thought about that's called the last mile initiative, on how do you get items to the last mile. And what we saw, or what I observed anyway, during the response was not just issues with getting PPE or other medical items the last mile, was the supply chain impact and the distribution chain impact, and how the response of a whole of government, or a whole of US, or in this case, a whole of the world response had compared to just isolated incidents like an isolated hurricane or an isolated tornado or a wildfire, or even a dirty bomb in a specific city. So I saw that as a major challenge, and we saw that come to fruition in a magnified effect in the event. In addition to that, there was a lot of strain on the supply chain, and which in some ways restructured the way the supply mechanisms work, and also brought in bad actors into the market. And so there were lots of market integrity issues. And then it highlighted some issues that I know Greg Burrell and I have known each other for a long time, that Greg and I have both talked about, that would likely be challenges in with an issue with the work with the Strategic National Stockpile, and the way it's funded and the mechanisms and tools that it's given. So those are some of the challenges that I saw that caused me to start thinking about this paper. And I saw it both at the federal and the interaction with the state, but I'm sure, Steve, you saw it specifically at the state level and the local level, that was probably even more magnified than what I saw.
Yeah, that's true, John, and I share the concerns that you outlined. I think specifically from a state and local perspective, if you ask procurement directors of states, localities, I think they would speak in unison that from their perspective, the nation's intergovernmental system completely evaporated during the crisis of the pandemic, and particularly with regard to the supply chain and the availability of products. The counterintuitive, well, in order to have an effective intergovernmental system and certainly cooperative purchasing, it requires just that, cooperation and harmony among the various levels of government. And what we witnessed during the pandemic was cooperation giving way to competition for limited PPE. It was just counterintuitive to the whole concept of sharing and accessing government contracts. The fundamental criteria for government sharing at the state and local level of their own contracts is simply, it's about economy, efficiency, and effectiveness. And all of the state authorizing statutes within each of the states that encourage and provide the legal foundation for states and locals to share contracts is built upon that foundation. It simply did not exist during the PPE crisis, and it was missing in action. In addition, the key benefits of cooperative purchasing or aggregating purchasing and getting better pricing, that disappeared into and devolved into a fragmented market. Probably the most significant comment that you'll get from the state and local perspective is this was the Wild West. Bidding, product, pricing integrity was in disarray. I think, I'll leave it there, but those are the general comments, and I'll get into a little more of the state and local perspective as we proceed. But certainly agree with everything you had to say, John, from a federal perspective, but the folks on the firing line that we're trying to deliver really were in a state of chaos. And it was due to the fact that the intergovernmental system failed when it was needed most. Greg, from your perspective, problems you saw during this crisis?
So I appreciate everything that's been said. I'll talk a little bit about my perspective sitting outside and watching, but I'm going to put back on that S&S director's hat a little bit and talk about what I would have been thinking about, what my concerns would have been. And many of these things are things that John and I have discussed over many years of working together in a variety of this, spaces related to this. So I think that the description as the Wild West of purchasing is apt. But I think we have to explore how we even got to that point. So one of the things that a lot of people don't understand about the U.S. healthcare supply chain is it runs under a very strict just-in-time model. Nobody wants to end up holding inventory and having to pay the cost to hold that inventory and so on. People are concerned about inventory that might expire on the shelf, and criticism from anyone from hospital administrators to shareholders or anyone else, and we get concerned about in the S&S as well. But what this resulted in is a situation where there was almost no healthcare facility that was prepared to deal with a very large surge of patients that required this kind of material to treat. I think the second piece of that is, again, looking all the way back through the supply chain, in fact, into raw materials. There's really only enough of this stuff on the shelf to supply orders over about the setting all the way back to the manufacturer. And what that does is it creates a position that there is absolutely no flexibility at any level. I think what we saw as a result of that was a call from the states to the Strategic National Stockpile to provide that product. And there are pros and cons to talk about there, but the reality is the S&S was designed under the Public Health Service Act to respond to chemical, biological, radiological, and nuclear events. And it has never been funded in such a way that it could really address pandemic supply needs. And of course, there's always the question of emerging infectious disease. What do you buy? Respiratory protection would be a pretty obvious piece, but without enough funds to do that, it's hard to do that. So you begin, particularly in commercial items, to rely on the market to operate in a way that makes sense. And unfortunately, for a pandemic, the market doesn't make a lot of sense. So I think that we can take a look over time at how do we create flexibility in that supply chain? What should we do at a state and local level, whether it be as a result of federal funding, state and local funding, or a combination of the two, to reestablish what many states used to have in the way of their own stockpiles of material, so they could use those before reaching back to the Fed. And then many of the other things that John discusses in the paper, like a working capital fund and so on, can be considered to help underwrite further needs of the S&S and being better prepared. And John, I'm sure you'll lead us into those conversations as we go along. So thank you.
Okay. Why don't I just kind of summarize the article, and then I'll talk a little bit about the more of the just-in-time, and Steve will let you talk about the market integrity, and move to Greg, but obviously comment on any parts that you desire. So I began working on this article in January, and interestingly, Mark Pisano, who's on the panel here, he noted how the president had put out a executive order on the 24th of February, which was apt to what I was doing, and in part of it, I'll quote him. The executive order is to address the issues of both concern of our economic security as well as our national security, the resilience, reliability of our critical supply chain. And that was really kind of the focus of how do we look for resiliency and that impacts the economy and the national security of the supply chain. So in the pandemic, we talked about a lot of the structural problems already, and some of the behaviors of some of the different bad actors that were out there, and the design of the supply chain. So in the article, I tried to focus on 3 specific policy recommendations that could address the resiliency and the diversity and the readiness and the security aspects of the supply chain. So the 3 aspects were, as Greg was alluding to a minute ago, the just-in-time or the stockless stockpile, and I'll talk a little bit more in detail about that. The integrity and the market transparency, and that, just to kind of highlight, there is not a simple way to check for validity and integrity. And so a suggestion that I make in the paper is, if we were to use blockchain technology tied with RFI, you could check the validation of the 510 certifications, for example, on different medical PPE. You could check the validity of ASTM certifications. You could check the tied to an RFI. You could check and link it to inspections that are done as they're leaving the factory through third-party entities like SGS, and you could track that and follow that all the way along. And instead of taking sometimes and some of the work that I do is I help folks broker large PPE contracts from factory allocations. That can take 5 to 6 weeks to broker a single, multi-month contract, and they can fall apart at the last minute because when you're doing a validation, one of these things that is said to be there is not there. But more importantly, it could protect us from the gray market material where people are dropping it in and they're not even trying to do it through the right channel, because they wouldn't have the they wouldn't have a blockchain value chain that would be able to show that security exists. And then the third part was looking at the strategic national stockpile, and I tried to highlight the fact that if you took the $8 billion in the strategic national stockpile, it's not designed to be the gap filler for the entire federal country. It's designed to be a gap filler in certain regional needs, and it's designed for a very narrow purpose, and it relies on the supply chain itself to be there. And more importantly, they don't necessarily have the tools that they need to be able to operate in the most efficient way. And for example, if they buy 5 million N95 masks 10 years ago, at 5 years later, when they expire, they have to throw them out, or they have to extend their shelf life. But the federal government uses N95s. And so with a working capital fund, when you're not in the pandemic, you can rotate that stock and get the reimbursement from the other agency, and then resupply it with new items and not require you to have additional new funding. So that would really extend the power of what they're already being funded, so that it would leverage it even more. And what I tried to highlight as well is just anecdotally, if we assume that everything in the stockpile, which it doesn't, had a 5-year service life, it would take between 11 to 14 years at the current funding to replace everything if you weren't buying anything anew. And so I think we've got to look at creative ways like a working capital fund to better leverage the funding they're getting, and then to have a discussion about what their funding should be based on what their mission is, because their mission, as Greg pointed out, has expanded over time. And a little bit more about the stockless inventory. Greg covered it fairly well, but we observed a high rate of resupply. Most hospitals carry 3 to 7 days of stock in these items, and most every one of the 6,500 hospitals around the country, whether they were directly impacted by COVID at the initial stages, all responded the same way. They hit resupply, and some of them hit resupply 2 or 3 times. And the demand signal that sent to the market overwhelmed the distributors, and it overwhelmed the manufacturers because they didn't have lag time to respond to that. So the recommendation in the article is to build what I call a strategic stock bubble. And to distinguish this between the stockpile and the stock bubble, at least in my mind, is a stock bubble is rotational stock. And so to build a 90-day supply of what a hospital normally uses as a stock bubble that could then be rotated through, and it would give them a cushion before they might have to hit the resupply button. And because you see the events occurring of the pandemic, the distributors could start stocking up faster and earlier, and it would give the time that's needed for manufacturers to build out their resupply. And to dealing with the issue that Greg alluded to of the financing is there's more than 6,000 of these hospitals that are already in CMS, and they participate in Medicare and Medicaid. And CMS has mechanisms to where they can pay for financing. And so CMS potentially has the mechanism in place to be able to use this under their reimbursement mechanism for paying for the initial financing of the 90-day supply through existing reimbursement mechanisms that it already has. So I don't really think it's actually that big of a heavy lift. It's just a policy issue that Congress would need to kind of think about and work through. And so on that, I'm going to turn it over to Steve to talk about the market integrity or any aspect you'd like to.
Great, thank you, John. And again, great, thoughtful recommendations, and certainly ones that should be considered as we face future national crises. So in talking about market integrity, again, from the perspective of the state and local market, I think there's some fundamental things that were missing during the crisis, and I alluded to them, but to be more specific, there was a vacuum of national intergovernmental system leadership. It was a fragmented approach at best. So there was nothing for a state or local agency to attach itself to coordinate its response. That was one of the fundamental pieces. Second, we began this process of competing with the federal government for limited supply PPE. And I can't tell you the number of times I've had conversations with local and state procurement directors who were literally racing with trucks to a port of entry to beat the federal government there so they could get the order that they made before the federal government took it. And something's wrong with that picture. A complete breakdown. I mean, it'd make a great cartoon, but nobody would believe that happened in reality. And it did, over and over again. I think the other fundamental is none of us believed that the intergovernmental system could evaporate overnight. And it did. It showed us a lesson learned, the fragility of intergovernmental systems and cooperation. It's something in the long term we all need to talk about and correct. I think when you get to a situation where it's every person for themselves, it creates a situation where there is no team, there is no harmony, and there is no cooperation. So that is the foundation and backdrop under which the conditions were ripe for a lack of market integrity. We're all aware of the stories of price gouging. I can tell you again in my conversations with state and local procurement directors, for a mask, they were paying 5 to 7 to 10 times what they paid before the pandemic struck. And something is wrong with that picture, and nobody there was there to help regulate, to address that issue, and they just suffered through it. In terms of product standards and quality, because of the limited supply, there were what I would call people that popped up overnight. Probably the majority of suppliers that state and local government agencies were dealing with had not been in business prior to the pandemic. So that shows us an extreme weakness in a quality control. So product standards and quality and delivery became a sea of risk and variability. You never knew when it was going to arrive. You never knew if it was going to meet the minimum specs. And you never knew what product was going to show up on the other end. It was a complete breakdown of any market integrity that we were all used to. And again, I think it was one of those things no one in the intergovernmental system could have imagined before this hit, but lessons learned. So a couple of things. One, competition and scarcity imploded our intergovernmental system. And when we look at reform, not just with regard to pandemic, but with climate change, any national crisis that you can think of, homelessness, where it's pervasive throughout the country, we really need to start first with the integrity of the intergovernmental system in order to have integrity in the marketplace. So those are just my views, and I'll turn it over to Greg. Certainly he has a great perspective from his past that can help with this.
Well, thanks, Steve. So, over the last year, I've been asked to testify twice, once to the Senate and once to the House on these matters, and I'm quite honored that they would continue to call me after my retirement, but spoke to some of these things there, and some of these really interconnect with what both John and Steve have talked about. So I'm going to start with a couple of items from Steve's comments. The idea of fragmented federal leadership. Steve, I agree with you completely. And John, you were sitting in it, and so I know you'll have a perspective on this as well. But looking at it from the outside, what I did not see were what were supposed to be in-place systems for a public health emergency response, including to supply chain shortages and that kind of thing. I did not see them working the way that they have been designed, planned, trained, and exercised. Instead, there were decisions made to toss, if you will, certain responsibilities to other agencies and departments who, in natural disasters or in supplying the warfighter or whatever, have responsibilities that run parallel to what the leadership of a public health response should be doing, but not necessarily in the same way. And so I think that caused some of that fragmented federal leadership. If we train and plan to do something one way, we need to do it that way. And I just didn't see us do that. Steve, I completely agree with you that the competition was a disaster. And when I heard commentary on public source news that, it was being suggested states all go try to find their own things, I thought, God, what a disaster. You've just made this problem far worse. So there are a couple of principles that I think are important to understand. Number one, trying to buy supply items, particularly supply items that are normally in a tight supply chain in the midst of a disaster, is always going to create a market problem. And one of the things under my leadership that we always try to do in the SNS is if we entered a phase of response where we were asked to make massive purchases to be better prepared in that instant, we would try to hold those off by saying, if we become the major purchaser of those products, then we destroy the market for the states who need to buy, for the healthcare facilities who need to buy, and so on. And the way to fix that is to be prepared in advance. And the way to fix that is to think about, at both the federal and collaboratively with the state and local preparedness folks, how do we jointly be better prepared for that initial surge need, and then to pick up with a longer term capability to continue to supply at a much higher level than normal. And I have some thoughts about how that can be done. I want to go to John and the paper again. I agree, there is always a mixed demand signal in this problem. Part of that is because of the way the market allocates scarce resources. Long conversation to be had about that, but let's just say that it is not as beneficial in a crisis as it might be in just day-to-day operations to make sure you've got enough stuff that gets around to where it needs to go. But what we saw, for example, in H1N1, and we tried to speak to this for years and look at ways to solve for this, is, let's say we're hospital A and we have a contract with distributor A to provide PPE. So we will place an order with them, but because of shortages, they may say, well, you can only have 90% of what you asked for. So then the hospital goes to sub-supplier B and says, I need the same amount that I just told supplier A. And they say, well, I'll get you 80% of that. And then they go to supplier C and they may get them 70. But what happens is the instant the first order comes in that meets their requirement, they go back and cancel everything else, which creates a terrible demand signal in the market. And so one of the things that could happen is we could think about how the stockpile could be resourced in such a way that for those companies willing to come to the fore and surge, if they were left, holding the bucket, so to speak, at the end, they didn't sell all their product, that maybe S&S could buy it at a discounted price. I think the working capital fund concept is very important. It is a way to take appropriated funds, invest them as they are designed to be invested, and then at the appropriate time, resell that material. For example, if we're talking in 95s, when they become within 6 months to a year of expiry, we resell them to another federal agency that can use them, possibly at a slightly discounted price that we paid. And then we use that money in a working capital fund to go back and replace those, versus expiring them, throwing away, and having to ask Congress for additional monies to replace those. The other comment that I would have is, and I'm going to go back again to the competition, to the preparedness and some of these needs. One of the things, and John and I have discussed this in the past as well, is if S&S was provided with something like the old Biomedical Advanced Research and Development Authority's Special Reserve Fund, so that there were monies available throughout a preparedness phase that we could invest in a manufacturer, whether it was to build new lines that turned 100% towards the S&S at need, but had to be operated on a warm base at the company's expense after they were built, or some other joint venture type arrangement, so that we don't have to put on the shelf, let's say, 3 billion N95s, which we actually calculated a potential need for that based on current population with a 1917 type flu scenario, and we estimated we could fill every warehouse in the United States with these, quite literally, but yet really never achieved the number we needed because of the manufacturing capabilities. So maybe you hold that supply bubble at the hospitals, you hold another bubble at the state and locals that is funded by federal grants, cooperative agreements, or a combination of that and state monies. And then at the stockpile, we hold our own 90, 120-day supply to allow the market to react in a different way. So I think there are a lot of things that could be done to make this better in the future. I think John's paper does a great job of laying out some of these issues. And I think it's something that, we all should continue to pursue and see how we can make this better for the next time around. And I'll underscore one last item. The Strategic National Stockpile must clearly be given the mission to be prepared not only for the seaborne space, but for emerging infectious disease, rather than it just kind of getting lumped on top of everything else. And it must be resourced appropriately for what the public and the Congress expects it to do. And I think that that is the underscoring of all of we talk about here. John, I'll go back to you.
Thank you. I think we are going to allot some time for questions. And I know Mark has a few comments before questions start. So Mark.
Thank you, Catherine. Some additional items that I didn't mention as I introduced the panel was that when I first read John's initial draft, it became apparent, readily apparent, that what we're talking about today in the supply chain is probably the most concrete, vivid example that we can give, that we can get our hands around about why intergovernmental, and let me add, cross-sectoral mechanisms are needed if we're going to deal with critical public goods issues. The executive order that I mentioned to John from the president noted not only for critical public goods issue, but also for some of our private sector regular market competitive issues, and those have been in the press recently. But coming back to the paper, it is probably the best example of what Shelley and I are attempting to do in the Intergovernmental System panel, is to have vivid, concrete, understandable examples of why we need intergovernmental policies, which have been spoken to by John, Steve, and Greg, but also why we need an intergovernmental systems design or institutional design so that we have not just policies, but institutions that can enable us to act and make intergovernmental or cooperative systems work. And in that respect, Rich Callahan and I and others have been writing some, let's just call them initial cuts at what an initial institutional design structure might look like, so that we could take this concrete example and use it to help describe what we need to begin to create. And I can't think of a better source in the country than the kind of on-hand experience we just heard from our three presenters to be able to craft that structure. So I hope our questions begin to flesh that out and mobilize it. Catherine, back to you.
Yeah, thank you. So we'll open it up for questions. And I would ask anybody to shout out their question.
Hey,
Rich?
Catherine, there's one comment in the chat, and I'll just address it real quick while folks are doing that. And it's a question about the manufacturers of PP should be, ISO and 13485 compliant as a medical device. I think that structuring a system that, and that's where the market integrity blockchain comes in, is that those are the types of things that can be validated in a blockchain type of mechanism up front. I do think things ought to be, there ought to be a minimum standard. I think it ought to be medical compliant. I mean, I think that ought to be the start if it is the medical response. And I know that, last year the administration expanded any NIOSH approved N95, for example, that could be used in a hospital, even if it might not have met some of the medical standards. So I think from my perspective, I totally agree. And on that, one aspect of that part that I wanted to mention is that is an intrigue. My market integrity one on developing a blockchain requires the most amount of work, because it really gets to what Steve was pointing out, is that relationship between industry and the local governments and the federal government. I do not believe, in all of my years working with the government, that the government can set that blockchain standard on its own. I think it's got to be very similar to how the JCO standard is set that CMS uses for healthcare quality and safety. And so I think it has to be a not-for-profit body that facilitates and houses input from industry and participation from industry and participation from the local and the county governments. I mean, if you think about it, the federal government only purchases about 4% of all of most of these types of products. And so, but they can drive that if they then take that that standard where they have a seat at the table, but they don't own the table, and then they put it into their FAR, Federal Acquisition Regulation. So long answer, Eric, to your question and the comment, but I just want to kind of tie all those together because I think that industry has to be involved in setting that standard.
Thank you. Thank you. And I think Rich and then Shelley.
My question was to Catherine, and I think Bev Sigler were here. With your experience within emergency management, how do you see today's discussion fitting in? Mark Pisano talked about the overall intergovernmental system, but Bev and Catherine, within your widespread experience in looking at emergency response, how do you fit today's discussion in that as well as within the intergovernmental system?
Well, I certainly see it fitting exceptionally well. I mean, at this point in time, governments are going to be dealing with multiple disasters of all sorts, as we know, natural, biological, man-made, accidental, ransomware, all the time. And so it's regions of the United States are going to be under the gun constantly. So we need to have an intergovernmental system that's responsive, that's flexible. As we all know, all the states have emergency management agencies that operate differently. And so that puts another complication into a well-working system related to emergency management. So the idea that we can incorporate blockchain more effectively and streamline procurement and contracting throughout the nation is something that is vitally important today. And we know that as we know, it's sort of turned into Mad Max, a Mad Max, the earliest movie, certainly. And we want to do a little better than that. So Bev, I know Bev Sigler probably has some more insight into this too.
Yeah, I have a little bit of a different perspective. I think that if you go back to the Stafford Act and take a really close reading of it, it is not ambiguous at all. It specifically says that the president and the national government's responsible for doing the coordination within the system. And this is especially the case for a quote unquote incident that is bigger than a single incident. So a rolling disaster of unknown ending falls into that category. So I've just written an article, I have it out, I expect it to be published soon, which takes a legal perspective and looks at public law and health law and the Stafford Act, and then the National Response Framework and the National Incident Management Systems, and these what are called essential support functions. And while the wording might be a little fuzzy between the word incident and a pandemic, it's clearly the national government's responsibility to do the coordination. And then if you look at the hundreds and hundreds and hundreds of pages and dozens of plans that exist, it's also very clear who's responsible. And so I think the failure was a failure of over many years of not integrating plans. And that's why the national government failed with its own internal coordination. And that's why the leadership, as Greg mentioned, federal leadership was flawed in terms of coordinating the intergovernmental system. So I think what needs to be done from a very broad emergency management perspective is to sit down and start integrating plans and talking about real responsibility. And again, it is totally clear. There's a line in Stafford that says the President of the United States is responsible for coordinating the system, period. And then beyond that, I'd ask some questions of Craig. I've read a little bit about the stockpile system, and in terms of who makes the decisions for how to stockpile. And I think for this disaster, it was the decisions of maybe one person really that moved that system heavily toward bioterrorism and neglected other things. And then you throw in the lack of funding and all else. But my question to Greg would be, what is the presence of state and local input into the agencies that make the decisions about what is stockpiled?
So I'm going to start with how the formulary is developed. So there is a large governance body called the Public Health Emergency Medical Countermeasures Enterprise. That body is composed of subject matter experts in disease threats and in other things such as obstetrics, pediatric specific needs, other vulnerable population needs, and so on. That body makes a recommendation to the secretary that is ultimately decided at a higher level governance group to approve those recommendations or not. So I'm going to speak directly to your comment. There is not a situation where one person changed that formulary, regardless of what you're reading in the current press, and made it be something it was not intended to be. That formulary has always been built around chemical, biological, radiological, and nuclear events, with the exception of supplemental funds that were provided in the early 2000s specific to pandemic influenza. So for all of the last administration, we were really working with recommendations from the FEMC that had been made years previously to provide for the stock. So, just understand what you're seeing in the press today about a single individual changing what was supposed to be in it. Didn't happen, can't happen, just is not correct. The fact of the matter is, we must continue to invest, particularly in biologic agent products that if you stop their production, if you don't have a warm base operational, you can't buy them at the time of need. And it's a very expensive endeavor. And the stockpile has never been funded to the right level to be able to do what it is intended to do around chemical, biological, and radiological and nuclear response. We were never provided additional supplemental funding for pandemics after we used much of the material that we purchased with pandemic influenza supplemental monies in around 2006, 2007. And I'm going to ask John, would you comment on this?
No, I mean, I totally agree with you, Greg. I mean, as you know, I used to be on the Labor, Health, and Human Services Appropriations Subcommittee for 7 years, where we funded,
Yep.
the Strategic National Stockpile, and and I'm not going to lay the blame on Congress for not necessarily funding it. It's really a combination of recognition of what the real need was and having it flow in a request through OMB to Congress. And, I suspect that at the program level where Greg is, there was a real recognition of it, but given the process of how things come up, but I think you're spot on, is that the process for setting the formulation, it's just like any other government program. The people who execute something in the middle of a crisis are living on the policies that were made 7, 10, sometimes 20 years in advance. Right. And you're just responding with what you have, and you're stuck with that. I do agree with Beverly as well on the fact that, and it ties to your point, Greg, is the structure that that we plan on and build around didn't get implemented in the same way that it was planned and organized around. And I suspect a lot of that deals with interagency coordination in advance, because it's mainly the same players that do the exercising, and that then when it expands out, you bring in players who don't understand what the system is put in place to be. And I'll give a parallel. in 2003, when I went to Iraq and I was doing air medical airlift, there were people, there were some people like, hey, John, we can set aside some of these different flying rules because, you know, we're in a war. And my point was, no, I was the director of operations for that particular unit. That's the whole point of these structures and these policies. And so we train as we operate, and that's how we did. And that's why we were successful in our mission for taking care of our troops who got wounded or injured. But it's the same type of thing here. And I think that there's people were making decisions based on what they thought was the best information that they knew in the short crisis of the middle of a fire, where you have 1,000 people going in 1,000 directions. You're working 24 hours a day, and you got some people that are pulled in at the last minute who may not fully understand the structure of where they're at, and that's the fog of war that happens. But what we can do is try to minimize that over time by taking lessons learned, improving that coordination, looking at the legal structures that Beverly's pointing out, and saying, are they structured the way they should be?
And Shelley, I'm going to give Shelley a chance to ask her question real quick.
Sorry about that.
No. This is so interesting, guys. I'm so thrilled we're looking at this. Let me just ask a question building on some of what you said. So when I listened to this, clearly we had a disaster. Just the purchasing free for all was clearly a disaster from anybody watching from the outside. What we need inside government is people who individually are skilled, and just listening to all of you, I was going, yeah, we got a lot of people with a lot of know-how and skills and experience, and then networks of people who are working collectively and talking to each other. Now, when I was back at EPA, way back in my first stint in the maybe it was second stint in federal government, there was a guy named Jim Macris, and the emergency guys would meet regularly to talk about how to do this. I don't know if that still exists. I assume it does. So one is the people in the networks. The second is the legal authority. And as Bev said, there are a fair number of legal authorities that are already in place. And then there's a third issue, which is the dollar sufficiency, which maybe it wasn't enough beforehand, but it certainly, the dollars were coming in the real time. But from my perspective, from the outside, it looked like a bigger part of the problem was the political perspective and choices made about whether or not the federal government was going to step up and play the role the federal government is authorized to play. And there was an explicit, although maybe not articulated, political decision to say, no, this is not, the feds are not going to step up and play the role they need to play here. And beyond that, there may have been some weakness in the capacity of the political leadership to know how to tap the career leadership. My question to you guys, and you don't need to answer it on this phone call, but my question to you is, what happens, how do we keep that from repeating itself?
I would disagree with your whole premise, Shelley.
Okay, thank you, that's good.
Because I was there, I lived it, that what you just described did not happen to that extent.
Okay.
Certainly there may be examples where you can find an ad-off example, but in the whole, your comment about the money came in and we had money in real time. Money in real time doesn't help with preparation.
Exactly.
Giving me $400 gazillion once the fire is there to put in the sprinkler system doesn't help me put in the sprinkler system.
Yep.
And the mechanisms and the speed at which you have to move is very quick when you're the firefighters.
Right.
The other comment is you're discounting the role of states and states government and federalism.
Yep.
The states were pushing back and saying that is not your job to tell me how to run the state.
Right.
And so while sitting in an armchair, we'd all like to think how we would do it and how we would interpret it. The fact is that all of the time, we don't always see in our armchair what all of the other aspects are. And so I would respectfully just push back and say, certainly there may be aspects of that where something may have occurred, but in the main, I did not see that from my seat in the whole.
That is spectacularly good feedback. Let me urge you guys, as this evolves, to get that perspective on the table very vividly, so that those people who had the initial reaction I did, you know, because I loved your paper, I thought it was so interesting, but to me, it was like politics was the dominant issue. And you're saying, oh no, it's preparation. And, you know, my husband's now talking about Rhino, which is like, nobody's willing to do the advanced work. How do we get people willing to invest? How do we do an after action review here that makes sure we don't go back to where we are now? I think that's a very helpful reaction. Thank you.
Well, I think that brings us to a great point. Steve is going to talk about the role that NAPA can play and how it's vital that we continue knowledge building and dissemination and exposure to grapple with these problems. So Steve, I'm going to turn it over to you.
Great. Thank you, Catherine. And the lesson here, and all of you are not old enough, but I remember the gas crisis in the 70s. And you remember what happened after we all stood in line for hours and sometimes days, trying to get gas. As soon as the supply increased, all preparation and planning for a future crisis evaporated.
Out the door.
So how are we not going to repeat that in this circumstance? And I think we've got a consensus here. With John's help, with Greg's help, and the great questions that were asked, it's clear we all have a consensus that the pandemic exposed a fractured intergovernmental system. So where do we go from here? And I think at times, again, from a state and local perspective, we become too federally centric in our planning. Not that that's not an appropriate role, as Bev pointed out, that there is a key and critical foundational role for the federal government, but somehow we have to enlarge that and make sure that we're working in harmony with whatever the plan and design is for the future, with federal, state, and local governments being engaged and understanding that for the most part, the delivery of these services comes at the local level with first responders. And we talk about healthcare, and that certainly was predominant, but without those first responders, in place and having the PPE, we were completely unprepared to go forward. So I want to leave us all with some hope. And the hope is that NAPA has formed a working group to consider establishing a center for intergovernmental partnerships. And I think we can all agree that whatever national crisis or even regional crisis occurs, it requires that cooperation between the various levels of government to be effective. And I would point out, just think about the difference between the implementation at the crisis point in PPE versus the rollout of vaccinations. And just compare and contrast with a little communication and cooperation among the various levels, how well things can go. And how do we keep that momentum going? And I think that's the focal point for NAPA in considering this Center for Intergovernmental Partnerships. It provides leadership, capacity, the skill of all of you contributing to it from various perspectives. It's about the grand public challenges and understanding that we need that leadership to approach those. And it provides a forum just like this for dialogue and problem solving through an intergovernmental systems lens. To that effort, where we are with that right now, the working group is hard at work, and we are gathering the support of state and local government associations. We are approaching the executive branch and Congress for that support, and we're moving it forward. So I think we really do have a forum that's being developed and a center that's being developed around this issue and all issues that are grand public challenges that we need a plan and a design and an implementation approach. And so the future is bright. There is hope. And I think the lessons learned here are being worked through this working group and the design of the center. So stay tuned, it's coming. And I think we're not going to let this one go. And hopefully it won't be another gas crisis.
Hey, Steve, could I ask you one quick question?
Sure.
It seems to me that center, as I hear more and more about it, could be that not-for-profit body that could coordinate and facilitate the development of that blockchain technology because of its position to be able to bring the industry and the counties and the states together with federal partners. Do you think that that's too far of a stretch, or is that reasonable?
Well, I think it is something to be considered, but just take one step back. We have the ability to take a look at that need from a Napa perspective and all the talent and capacity we have, and really make a recommendation, do a study and make a recommendation that gives that some legs. So without going to the exact structure we would use, I think the center is going to be about taking all your time and talent and focusing it to what does make sense and what is the appropriate structure.
Thanks.
Thank you.
I also have just a nitty-gritty question. In terms of the National Strategic Stockpile, it's relatively easy if you do it right to know what's in your stockpile. But is there any state that has a system of knowing what their hospitals or medical facilities have? Or and I assume there's nothing nationally that really knows what the inventory is across the state and local governments.
So your assumption is not 100% valid.
Okay.
There is a national mechanism in place that we put in place last year. There's a lot of proprietary information in that. I'm not sure that legally that structure will be able to stay in place operationally. But on the national level of looking into hospitals and with the distributors, that has been a voluntary as far as I know, a significant number, if not most, of all the hospitals participate in. And so there is a mechanism in place. I think most states have a stockpile and know what's in their stockpile and have mechanisms for that. And I think at the state level and how they coordinate across each state is probably different. And Steve and Greg might have more information on that.
Yeah, I would generally agree with John. One of the issues around state stockpiles or local stockpiles, particularly in case of large cities and territories and so on, is there were a number that had invested in stockpiles of their own materials. Much of what would have been needed here were not included in those formularies, to my knowledge, and most of those went away when we entered the financial crises that we started to see a few years ago, as state legislatures would no longer allow funds to be spent to warehouse and hold those materials. So,
so in other words, it's an example of where there is a good national rule that could be integrative and maybe set some guidance of the formularies for what should be considered in a stockpile by the states. And that's the way to get good data nationally to be able to plan for the future. And I could think of doing that so many areas where we just didn't.
I'm going to take an opposing view.
Okay.
Yeah. So I think that states, by and large, at the level of the FEP directors, the Public Health Emergency Preparedness directors, and the SNS coordinators, have a pretty good understanding of what we include in the SNS and why it's there. Even though there's not a formal role for them in that, we do work with them through ASTO, NACHO, and other organizations to keep them current. The issue becomes that they do not have the funds available to make those purchases, and they choose to use grant and cooperative agreement funds for other critical needs that are not being covered in an appropriate way. So I don't fault them for that, but there is little capability at the state level to build significant stockpiles and to maintain those. This is a very expensive endeavor.
Great, thank you.
Thank you, everyone. I know we've gone a little bit over, but this has been a really enlightening time, and everyone's exuberance about solving these problems is really wonderful. And I hope that this will continue as we move forward with the initiatives of the panel and the working group. Thank you.